size is the database at Grovemount Hospital?
Pretty big. To give you some idea, over a 5-day period of care for one patient, somewhere in the region of 25,000 characters of data might be generated. That would include matters relating to the patient's medical history, laboratory reports, medical treatment, invoices, and so on. Now, if we have an average of, say, 300 occupied beds, that means well in excess of 500 million characters of stored data per year.
And that is presumably only data relating to patients?
Precisely. We also have data relating to the administration of the hospital. For example, information on staff, bed occupancy, that sort of thing.
So how exactly is the database organised?
Well, our database is organised in the same way that any other database is organised. The basic component is a named collection of data called a file. The file called patient, for example, contains the name, address, date of birth, National Health Service number, etc. of each patient. Within each file, there is a collection of records of the same type. So, in the case of the patient file, each record relates to a single patient. Each record must obviously have a unique identifier, so that it can be accessed in the database.
You mean a name or number?
Yes, usually a combination of the two.
Right. So each file contains an organised collection of records.
Mm-hmm.
Does that mean that each individual record has an internal structure too?
No, not necessarily. I've already said that all records in a given file must be of the same type. Well, all the patient records do have an internal structure, or fixed format, as we call it. This means that each component, name, date of birth, etc., is stored separately and can be accessed separately. However, some files contain free format records, and in those cases each record simply contains a long string of text.
You mean letters, reports, that kind of thing?
Yes.
I see. Now, can you tell us what happens when the database is updated?
Yes, each input message is called a transaction. When a transaction enters the system for processing, the computer must retrieve related data from the database. At the end of the processing, the computer stores updated data to reflect the changes caused by the transaction.
Could you give an example?
Yes, of course. Each time a patient is admitted to the hospital, the database must be updated to show his or her details. This is obvious. However, the database must also be updated to show that there is one less bed available. This will, in turn, affect summary operational data such as bed occupancy for the month and so on.
OK. But you have lots of different people accessing the database at the same time, don't you?
It's a multi-access system, yes.
Right. But what happens if two people access the same data at exactly the same time?
It can't happen. In that situation, the database management system would grant access to one of the users only. The other user would have to wait until the first transaction was processed and the data updated.